Vyzulta, latanoprostene Bunad ophthalmic solution, 0.024%, is indicated for the reduction of intraocular pressure, IOP, in patients with open-angle glaucoma or ocular hypertension. Please stay tuned for important safety information about Vyzulta at the end of this video. Dual-action Vyzulta reduces IOP by targeting the two pathways of outflow resistance. Once in the eye, Vyzulta metabolizes into two moieties. The first moiety, latanoprost acid, is a prostaglandin analog that primarily works within the uveoscleral pathway to increase interstitial spaces between the ciliary muscle, increasing the flow of aqueous humor. The second moiety is butanediol mononitrate, which releases 1,4-butanediol and nitric oxide. In normal eyes, nitric oxide is produced by endothelial cells in Schlemm's canal to regulate IOP. Human studies have shown that patients with glaucoma have decreased levels of nitric oxide markers compared to patients with normal eyes. A deficiency in nitric oxide is believed to play a role in chronic trabecular meshwork contraction and elevated IOP. This chronic contraction leads to a reduced trabecular permeability, decreased aqueous outflow, and elevated IOP. There are two key causes of chronic contraction in the trabecular meshwork. The first cause is activation of Rho kinase, and the second is activation of calcium signaling. Nitric oxide, as released by Vyzulta, relaxes the trabecular meshwork and increases permeability by activating the soluble guanylate cyclase cyclic GMP cascade, which in turn inhibits both Rho kinase activity and calcium signaling, leading to trabecular meshwork relaxation. Relaxation increases trabecular meshwork permeability, which leads to increased aqueous humor outflow and decreased IOP. Dual-action Vyzulta is the only nitric oxide-releasing agent that reduces IOP by targeting the uveoscleral pathway and the trabecular meshwork. Vyzulta, latanoprostene Bunad ophthalmic solution, 0.024%, is indicated for the reduction of intraocular pressure in patients with open-angle glaucoma or ocular hypertension. Increased pigmentation of the iris and periorbital tissue, eyelid, can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with a history of intraocular inflammation, iritis, uveitis. Vyzulta should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in aphakic patients, in pseudophakic patients with a torn posterior lens capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the use of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of Vyzulta and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater than or equal to 2% are conjunctival hyperemia, 6%, eye irritation, 4%, eye pain, 3%, and installation site pain, 2%. Please see full prescribing information for Vyzulta.